shot. Yeah.
This thing, it's so interesting because it actually began with the superpowers.
Correct.
And it's affected everyone. Yesterday we got news that the Prime Minister of UK, Boris Johnson, now has tested positive. His health secretary, and I think there was somebody else also within the health department.
The Minister for Health.
The Minister for Health.
Positive,
exactly. So, I mean, Prince Charles. This thing is just affecting the high and mighty, and I don't know, because Africa, we are also talking about the numbers may be understated, but when you look at the number of deaths, is it that it is still very early in the curve? We are still very early in the curve. I think many of us are just about 7 to 10 days or 12 days thereabout into tracking these numbers.
Yeah.
Why is Africa lagging? Is it because of the weather? Because people have blamed it also on the weather, that the warm weather is not conducive for this particular virus. Yeah. Or are we saying that people are actually sick, but they're not getting to the hospital?
It's a fair question. It's something we've been discussing and following through.
Yeah.
I think maybe I'd want to adjust this gun before I shoot you, as I did on the game.
Actually,
so
I was advised it should always face
away,
face away, face down.
At this point, I would have faced it towards you, but again, you're the enemy here.
No, I think let's deal with coronavirus first.
First, we can deal with the rest
then
later.
We can deal with the rest later.
Yeah. So to your point, I think why Africa and why we seem to be lagging on the curve as compared to our peers. And I think part of it is some of the reasons we've mentioned. That one, we are again grossly under testing, and that's due to insufficient kits, if we have any in the country. I know for sure we've seen global philanthropist Jack Ma donating a couple of thousands kits, hundreds of thousands of kits to Africa. So again, the time before that gets to all the 56 nations will take a while. But also we need to appreciate the fact that we are not as connected to the world as the Western countries are, you understand? So in terms of even flights per day, you can't definitely compare any country in Africa compared to your Western countries, to your Americas. So I think that globalization, where Africa is now one village, it is far more real to them than it is to us. You know, someone can take a flight on Monday in JFK, land in Sydney, land in London, and 2 days later they're back. We have seen that, yes, in Africa, but again, we are still lagging in terms of, the flights per day, in terms of how many businesses we have that have international exposure. So we are, for lack of a better word, we are sort of like an isolated sort of community to ourselves, and that has worked to our advantage, you understand? So we've not had many of these cases they're now calling the imported cases, you understand? So I think even most what you're going to see from Africa is what they're calling the community spread, you understand? Where you have it, you infect your brother, your sister, your neighbor, then it blows out. So I think that disconnect from the global world has worked to advantage. That is one. Again, as I mentioned, we are under testing for lack of kits. We lack the proper expertise. We lack the proper knowledge for the health workers and the equipment they need. And then again, we just reported our first cases less than 2 weeks, 2 days ago.
It's early days.
Yeah, it's still early days. So that curve we've seen, even the incubation, they're telling it's 2 weeks. And at times it can take even before you show any symptoms. You can be asymptomatic, and it takes between 5 and 14 days before you show any symptoms. So I think that's where we are as a country. And I think so far we've only reported 1 death here. So I think the next 2 weeks are what are going to be crucial for us and for the rest of East Africa, and surely for Africa. So I think it's not too early to start saying, we are safe. I don't know it's because of our weather. We now have it. We started by saying we are black, we can't get it. We've seen black all the way from America getting it and putting it out there that, this pandemic, this virus knows no race, knows no gender. It knows no boundaries. We've seen now, I think it's in almost all the countries in the world. I think Burundi, weirdly, is one of the exceptions. They haven't reported a case yet. So I think it's about time we need to face the facts and filter the noise. So it's not about your race, it's not about your weather, it's not about where you come from. It spares no one. And I think the next 2 weeks for sure we are going to see. And the minister has been quite vocal at it, in terms of we should expect to see the cases rising.
Yeah.
Yeah, more dramatic than we have seen them so far.